The Congressional Budget Office now says President Obama's health care reform package is likely to cost roughly $115 billion more than the original estimate. That means an additional spending over the next 10 years, if approved by Congress, would bring the total cost of the overhaul to well over $1 trillion. That brought stinging reaction today from Republicans who were saying, "We told you so." This is what Minority Leader John Boehner said. It was clearly irresponsible for Washington Democrats to force this legislation through Congress without being truthful about its full impact on the nation's finances. Republicans are fighting to repeal this job-killing health care law and replace it with reforms focused on lowering costs and protecting American jobs. NBC's Luke Russert live on Capitol Hill with more on this. Luke, good afternoon to you.
Good afternoon, Jeff. Absolutely fascinating news coming from the CBO today that says that the President Obama's Democratic health care overhaul could go well north of that unofficial $1 trillion buffer that he wanted to have. He didn't want to break that number. It was really supposed to cost $938 billion. That additional spending, although it'd be discretionary spending, could push it well north of that number. What is in this spending, Jeff? There are three things. There's 10 to 20 billion for administrative costs. There's 34 billion for community health centers and $39 billion for Indian health care. The reason why this money apparently was left out of the first time that this thing was scored was because it was discretionary and Congress actually has to move in order to fund it. So there's a chance that it could not be funded at all. That being said, when something like this is promised in the bill, especially the community health centers and the Indian health care, most likely it will be funded and it will cost the American taxpayer. Republicans are saying, just as you said, "We told you so." I spoke to one Republican that said back in January, we wanted the Democrats to slow down to get these numbers included. They went ahead and jammed this through. That is why we're seeing this today. Another Republican I spoke to said the $115 billion could just be the bare minimum, that in fact there could be all sorts of new spending that comes of it as a result of this law, something that we have to keep an eye on. The White House is saying President Obama will veto other domestic programs if this spending continues to rise.
Yeah, and Luke, you think about the Americans who are possibly on the fence about this health care reform overhaul bill to begin with. This really adds fuel to the fire. How big of a blow is this to the White House, you think?
Well, it's going to be interesting to see exactly how it plays out. I mean, sure, on its face right now, it doesn't look good at all because you're breaking the pledge of not costing more than $1 trillion. The other thing, Jeff, that got a lot of folks on board with this was that that health care reform would lower the budget deficit overall in the next 10 years by a number of about $143 billion. That was what the estimate was if this bill was passed. If this $115 billion goes on to that almost wipes out all the savings that were supposed to occur towards the deficit. So it's something that a lot of fiscally conservative Democrats and Republicans are having a problem with today.
NBC's Luke Russert on the Hill. Luke, thanks so much.